you have to drill. That one is part of the frontal process of maxilla. So inside here, there's a frontal recess. Here is frontal recess. So you have to remove this bone to go to see the frontal recess clearly. So frontal sinusotomy type 2A, you have to drill this. Drill the frontal process of maxilla till it flush to the lamina preferentia. So if you drill everything here, this one you drill, and then you can feel like a soft bone laterally, that one is lamina preferentia already. That one is 2A. Then that is 2A. So 2B, if you touch the septum, if you come laterally and then you drill where the anterior turbinate, when the middle turbinate, it attached anteriorly, it's not to the skull base. It's part of the frontal process of maxilla. So you can drill. Doesn't matter, you can drill that little bit. So when you come to the septum, that one is frontal sinusotomy type 2B. And then make opening at the septum is part of the 2B. When you drill the frontal keel, that one is modified non-prop procedure, frontal sinusotomy type 3. It can be touch the septum, or it basically if you open up and then you touch the frontal keel, it's to complete the modified non-prop procedure. Okay, so that one is how the frontal sinusotomy type 1, type 2, and type 3. So when you do a modified non-prop procedure or frontal sinusotomy type 3, when you drill, at the end of the day, you have to look like this. When you look up into the skull base, it looks like this. Yeah. So how if you want to do a modified non-prop procedure, there are two ways: antegrade or retrograde. So always that we do is antegrade. That means we drill the frontal keel and go into the frontal sinus and develop the pathway here. And in Italy, I think in Italy they do a retrograde. So retrograde, I tell you the retrograde first. I say it's look easy. Yeah? So it's look easy, but it can injure the clavicle plate. And so frontal recess is already, everybody is open up already, right? So you see your frontal recess. You see your frontal ostium. Yeah? You see here. So the retrograde, we start drilling from the anterior wall of the frontal recess or anterior wall of the frontal ostium. Drill anteriorly. To do that, our anatomy in our head we must be correct. So if not, we will drill medially and we will drill the clavicle plate. So that's why I prefer to do antegrade. So antegrade, we have to find the first order neuron. This one is first order neuron. First order neuron. This one, how we find the first order neuron? We have to, I will show because it is difficult to show on the diagram. We have to come anteriorly and we have to raise the flap superiorly. Make an incision, a inverted U-shaped incision, and then bring down the flap from anterior to posterior till we find the first order neuron. First order neuron is where the clavicle plate starts. So if we langgar this first order neuron, patient we will have dyspeptic. So when you raise the flap down, do slowly to see the first order neuron. The first order neuron is enough, so it's white in color. If you see like a little bit bluish, that one is accessory vein. Yeah? And then once you find the first order neuron, stop. Stop, and then you start drilling anterior to that first order neuron. So drill is like a fan, like a wiper. Can drill, go back, and then go right, left, and all that. So you will be safe because you know this one is first order neuron. And after that, once you drill, and then you really start here. So and then after that, we'll connect the frontal recess with the rest of a little bit bone here. Yeah, so when you drill, at the end of the day, it will be inverted U shape. Yeah, so this one is anterior ethmoid, posteriorly, and frontal recess, and this one is frontal keel that we have to drill. Once we drill the frontal keel, you can see the frontal sinus, and the posteriorly is the posterior table of the frontal sinus, anterior table of the frontal sinus. So if somebody asks what is the boundaries of modified non-prop, anteriorly is the anterior table or the frontal sinus. Posteriorly is the first order neuron, or the olfactory nerve. And then laterally is the lamina propria, both sides. And then what else? That's all. Okay, that's all. Yeah. So this one olfactory cleft, this one could be complete. So okay, this one take a long time to clean, but be patient lah. Yeah. So I will create on my side because if I show you take a long time. So I will record and I will show you. Okay.